Everyone, thank you for tuning in. My name is Dr. Jesse Morse, and I am a family and sports medicine physician practicing in Miami, Florida. And today we're going to talk about the top 4 toxins that are killing us. And unfortunately, these are things that traditional medicine does not really look for. And as a result, we have a tendency to accumulate these. And these are likely the culprit of many of our diseases that we really can't figure out what to do with. All of these autoimmune diseases and chronic fatigue syndrome and fibromyalgia, things like different types of cancers, Alzheimer's, Parkinson's. Why are we getting some of these diseases? And how are the environment and manufacturing has really dramatically impacted our lives compared to, say, 60, 70, 80 years ago. So if you haven't been here before, this is a podcast that I started a couple months ago because I wanted to share some thoughts about different topics that I'm passionate about, that I'm knowledgeable about, that I use and talk about in my practice every day, and share the word about different things that maybe you may not be aware of, or that may even help you or help one of your loved ones or one of your friends. So if you find this topic fascinating or any of the topics I've talked about, please share the podcast. Kindly leave me a review so that we can get the word out more. This is something that I try to record weekly, and I'm happy to entertain any different topics. If you're interested in one, please leave it in the description below, and I'll try to add it to the list of things that I'm going to talk about. So, the way I look at medicine is a little bit different after transitioning from traditional primary care and the insurance-based model to a model that is more based on finding the root cause, more of a functional medicine base, where I no longer just treat symptoms. I no longer band-aid with medications that are predominantly temporary. I'm looking for the culprit, and I'm trying to reverse things if possible, remove toxins, address toxins that may have accumulated in the body. Unfortunately, we've seen a significant number of different things that we will talk about today that are going to impact some of this stuff. And the first one we're going to talk about are heavy metals. Now, heavy metals are actually very, very common. The most common one I see every day is mercury. And you're probably thinking, where am I getting mercury from? Well, mercury is very, very prevalent in fish, especially if you eat sushi. Unfortunately, we cannot specifically identify exactly where it's coming from. My guess is that it's probably coming from the South Pole. So unfortunately, fish seems to have a lot of mercury. Now, you're probably thinking, how does this mercury get in the fish? Well, my suspicion is it's probably leaking in at the South Pole or the southern aspect of the world, and the little algae are eating or accumulating the mercury. Then the little fish eat them, the bigger fish eat them, the larger fish eat the medium ones, so on and so forth, and we accumulate the big ones. So you're really eating a combination of mercury, and when that happens, one piece of fish, you think of maybe swordfish or salmon or a tilapia or any of the smaller fish that they happen to use in seafood and in sushi. The problem is you don't know how much is in it, what is in it, the quality of it, the purity of it. You'd like to think, hey, I'm at an expensive restaurant, that should be good quality fish. Yes, but how much mercury is in it? And if someone could make like a little thermometer type of thing that says, hey, this one has significant levels of mercury, that would be pretty crazy, because I've had 24-year-old professional athletes in the past 6 months come in, checked their mercury, and it was 78 times normal. And this is not just in the blood. This is actually in the tissue. So if you just draw a blood level of mercury or aluminum or lead or any of those, unless those levels are astronomical, they're going to be low in the blood because they're not normally floating around in the blood. They're actually embedded in the tissues. Mercury loves to harm nerves. It loves to affect slowing processes, can affect kidneys, can affect all different areas of the body. Aluminum actually loves the brain. Lead loves bones. So there's different ones that have a tendency to accumulate. And remember, we're not supposed to have any mercury in our body. So you can get it from tattoos. A lot of the times they'll use red, and the red part of a tattoo is actually mercury based. Women can get them from makeup, especially non-US made makeup. All of these different types of makeups actually have a USDA criteria, and there's a threshold. But how many women just wear one makeup? Usually they stack it and layer it. Most of them wearing it every day. So think about your skin as accumulating that and absorbing that. And the problem is our body does not do a good job of getting rid of it. So whenever I see a mercury level in blood that's high, I know their accumulation in their tissue is going to be astronomical. And it slows people down. It has a tendency to make them not be as sharp, as intelligent. It makes people have a lot of joint pain. So it's a very fascinating disease. Now, the other one I see a lot for heavy metals is lead. So if you were born before 1979, you were exposed to leaded gasoline. Leaded gasoline was very prevalent back then. And the reason why they actually made the lead in the gasoline is interesting because they realized that they could trademark it. So therefore they could sell it and make money off it. So that's why they ended up using lead. The problem is 50% of that lead was aerosolized and we inhaled it. And as a result, that started to accumulate in our body. Now, our bones mistaken lead for some of our other compounds that look like it, and as a result have a tendency to pull that lead into the bones. And the problem is it doesn't usually get rid of it all that often. So if someone has been exposed to lead pipes or leaded gasoline, or had toys that had lead in them, anything like that, lead paint, then unfortunately they're going to have an accumulation of lead. And I've had a couple patients that are usually extremes, people that run gun ranges or people that have been shot and you can't get the bullet out because it's in an unstable location, like near the spinal cord. And that lead bullet will chelate into their body. I've had multiple people who work at gun ranges or own gun ranges, and their lead levels, because that lead gets aerosolized every time someone shoots a bullet, their levels are 7, 8, 900 times normal, like insane levels. So you're trying to think like, how would I get this out of my body? Well, your body tries to get rid of it naturally, but it doesn't do the best job. So then you can do something like, there's a couple different oral supplements that can help. They're relatively benign and relatively mild, but they'll help a little bit. Red light therapy and saunas and any of the heat, that type of stuff can help significantly. But we use chelation. So for heavy metals like mercury and arsenic, we use something called DMPS. And then for aluminum, lead, barium, all the other ones, we're using EDTA. So there are oral forms that you can get. They're usually like a 3-day on, 11-day off cycle. And then you have usually the IVs, which is what my clinic specializes in, are much, much faster. You have to be relatively aggressive. You can add in glutathione, which is a fantastic chelator. And actually helps to anti-age and helps to restore the mitochondrial function and help the liver. So it does a lot of other stuff. So this is something that we see pretty much every day. We are one of the few places that specializes in it. And it's unfortunately very common, but this is not a test you're going to look for. We actually do something called a provocation test made by a company called Doctor's Data. And this test is fantastic. Basically, what you do is you give your first morning urine, the one that's most concentrated, and that's your baseline. That's how much your body's getting rid of. Then you come in, we give you an IV, and with that IV, you start collecting your urine for the next 6 hours. and that's going to be what we call your post. So the IV we give you is going to be a chelation device, so either DMPS if we're looking for mercury, or EDTA if we're looking for lead in any of the other ones. Now, what that's going to do is that's going to go in and that's going to bind that heavy metal. When that binds that heavy metal, it has such a strong affinity for it, it will actually pee it out. And then that's when you're accumulating it. We're gonna check that. We're gonna send both the pre and the post off, and about 10 or 12 days later, we'll get a full report that gives us an idea of how significant your levels are. So if you haven't really had much exposure to any of these, your levels are going to be really low. If you've had a ton of exposure, and you may not know it, you're going to have a lot more. So while this isn't the cheapest test, it is way more sensitive than a blood test. As I mentioned, the blood test is not very sensitive at all, but unfortunately, that's what OSHA uses for environmental and stuff like that. So if their lead levels or mercury levels are high in a blood panel, they're going to be astronomical in a the provocation test that we use. But these are very, very effective. You can get these out. I've seen these come out. They do a great job. Unfortunately, you have to kind of stop eating the sources if it's a mercury-based thing like fish, because it takes a long time to get these out. These didn't go in overnight. They're not going to come out overnight. But mercury and lead, arsenic, aluminum, barium, which is in a lot of our medical testing, gadolinium, which is what we use for contrast for CT scans and for MRIs. Those are not benign. I had a lady last week who had not had an MRI in 5 years, and she still had gadolinium in her. That is a heavy metal that's not supposed to be in her body. Is it causing problems? Probably. The body doesn't know what to do with it. It's basically just causing problems and sitting in there. So that's part of the thing. We use these metals to help us visualize or achieve a problem, fix a problem, but then we don't realize that they're actually causing new problems. So recommendations wise, if you're over, say 45 or so, you probably should consider checking your lead levels. If you eat fish, especially if you eat sushi a lot, it would be in your best interest to check your mercury levels, because these are going to cause problems, whether you're in your 20s, your 30s, your 50s, or 70s, whatever it is. These may be leading to neurological issues. We don't know. Are they causing some type of cancers? We have no idea, because this is not something we traditionally look for. But when you look for it, boy, do you find it. And when you find it and you start removing it, it's like these people reverse time, because we're removing toxins that are causing problems. And that's the name of. That's why I named this episode this, because that's what it is. These toxins are killing us, and if you don't know to look for them, you're never going to see what they are, and you're never going to know enough to remove them. So I hope you found that fascinating. That's heavy metal toxins that are unfortunately very prevalent in our environment today. And you can identify them. I personally use the doctor's data test, and you can definitely get them out, and you will be healthier as a result. All right, the next section we're going to talk about is one that is very important, that a ton of people, I would say probably at least 50% of people struggle with this, probably more. It's literally ridiculous how common this is. So mycotoxins, or mold. So you're probably thinking like, yeah, there's a little mold on that vent. There's a little mold in my basement. I'm from Massachusetts. That's super common up there. But unfortunately, that mold generates what we call mycotoxins, which get released, are airborne. We can't see them. They're invisible. And sometimes, say black mold, for instance, it can release 4 or even 5 toxins at once. And we're absorbing these, we're inhaling these, and these are embedding in our body. They're embedding on our thyroid. They're embedding on some of the heavy metals. They may be sitting inside of our sinuses, inside of our deep face. They're wreaking havoc on our bodies. I had one patient who he went to Mayo in Jacksonville, and they had no idea what was going on with him. They could not figure it out to save his life. He was struggling to walk. He was in his late 60s, early 70s, and his brain was starting to fail. And they're like, "Oh, you're just getting old." Come to find out, he had astronomical levels of mold. He had astronomical levels of heavy metals. We pulled those out with different, IVs and things that we used. And the guy went from barely being able to walk to fully driving and riding ATVs. And it's been like 3 or 4 years, and he's like the same, still super healthy. So it's crazy what you miss if you don't look for it. Living in South Florida, I live in Miami. We have the luxury of heat, but unfortunately, that heat comes with humidity. And the nature of down here, if you haven't been here, is a lot of condos, a lot of apartments, a lot of smaller units, and you have AC running all the time. So you have some of that dripping from the condensation, maybe running in the back or in a wall. And mold loves anything that is wet. And it doesn't take more than a couple hours of something wet and sobbing, hidden, or we don't even think of it. And then you have mold start growing on that, and that's it. We have mold in our coffee. We can have mold in different types of foods. So you don't really realize where we're getting all these mycotoxins. So if these set of symptoms right here sounds like something you're potentially dealing with, you may have mold and mycotoxins. Now, brain fog, memory loss, slurred speech, chronic fatigue, chronic sinuses or chronic infections, runny nose, headache, wheezing. A lot of these are very vague, but unfortunately, that's what we are. So, most people, when I check their mold levels, they're positive. Some may be in range, and some are usually astronomical. So this test, the one that I personally use, checks for about 14 different toxins. It checks both the short term, which is called IgM or IgE, and the long term or IgG. And that basically means, when were you exposed? Is this something in the past, 3, 4, 5, 6 months, or is this more of a chronic thing? And the specific test that we use is something called mycolab, MYMYCOLAB. It is a blood test. You can order it online, and you can have it shipped to your house, and then basically prick your finger and then send it back off, or have your blood drawn. And what this does, this is a very unique test. It is very difficult to test for molds because our body struggles to identify them. So when our body interacts with a type of toxin or mold, whether it's T2 toxin or verruca toxin or and aspergillus toxins or penicillins or okra, vomitoxins, what it does is it creates an antibody for that specific toxin. Now, if your antibody for that toxin is 0, then you've never seen it. You don't have any exposure to it. If your level is supposed to be under, say, 0.3 and yours is 3 and it's 10 times higher than normal, you have a lot of that going on in your body. And it gives you an idea of, hey, is this recent, or hey, is this chronic, or both? Is this something that you've been exposed to recently, or is this something that you've been exposed to for many, many years or a long period of time? Now, unfortunately, these are not benign. These cause a lot of problems depending on which one. You have some that even cross the placenta and can give from mom to baby if she's pregnant. Obviously a huge deal. You're already exposing baby to a toxin that could be detrimental, and baby doesn't have the immune system to fight this. Mom doesn't even know she's giving it to baby. So that's oncotoxin. We have other ones that can lead to, destroying your immune system, leading to chronic like fatigue, fibromyalgia-like symptoms. They get mixed up with Lyme disease a lot. You can have injuries to the brain, the liver. They mess with sex hormones a lot. They love to mess with testosterone and estrogen levels. They can cause cancer. They can cause issues with the nervous system. So these are a big deal. They love to hang out with heavy metals. So that's kind of, a lot of the times we check both of them. And there's even different treatments that can actually take both out at once. And the cool thing about these is, once you get them out, usually you're pretty good, assuming the source is gone. And I've had people that are like different people after they're gone. They don't get sick anymore. They have no allergies. They feel like they have tons more energy. They don't have any pain. It's crazy what these stupid toxins can do, but we don't know enough to look for them. So if you don't know to look for them, you're not going to find them, and you're just going to assume they don't exist and they're not bothering you. But you don't know what you don't know. Some of the other things we can use for this are antifungals. So you're traditionally more itraconazole than fluconazole, and as scary as people think it is, the incidence of liver issues is very, very low. You can use ozone, which I talked about last week in my last week's episode, which is a fantastic option, my favorite option for mold, because mold is mycotoxins grow very rapidly. And if you knock it down once and then you wait 2, 3, 4 weeks before you address it again, it's going to be back to the same level it was before the last treatment. So you really have to hit it weekly, sometimes multiple times a week, or taking a medicine at home and really addressing it. These, you have to be really aggressive early on, and then you can finally kind of back off when you've handled it. But you have to make sure that you do not have mold in your home, in your work, in your office. And although we've had a lot of people get people to come out and check for mold, they say it's negative. They open up a wall and there's a huge piece of thick black mold or whatever it was just sitting behind it, because as good as those testing is for the companies that come in for the mold, it doesn't seem to be as accurate as we would like it to be. So understand that if you feel that there are mold, if you're living in a home from the 1700s, the 1800s, or something that had, water damage, you're probably dealing with mold, and it's definitely impacting your health. And it will eventually, sooner or later, it will cause issues. It is in your best interest to at least see if you have any mycotoxin exposure, and at that point, what you should do about it. So hopefully you found that helpful. That was about mycotoxins and mold. Very frustrating, very prevalent, and something that someone should at least check out in their lifetime, at least once, to get a gauge of how much it's potentially affecting them. So the next one we're going to talk about, we're going to hit this one strong to finish up strong, and this is going to be something that we talk about intermittently, but I really want to focus on it today. There's many different toxins that we're exposed to in everyday life. Some we don't even realize exist. And many of these are to optimize farming and to optimize the sale of products, or to make things stronger. And the first one is glyphosate. Or glyphosate. I always screw up the pronunciation for this. So these toxins are produced that can be absorbed, inhaled, and ingested, that can cause acute or chronic overload. These are pretty gnarly. These environmental toxins, they can cause issues with tissues, with organs, at the cellular level. Many of these can cause cancer or disrupt the endocrine system, as we'll see in a little bit. And the susceptibility really depends on the person. It's a person to person. Some people that have very poor immune system and they get overloaded, and other people that have a fantastic immune system and they don't have any issues, and they can fight these, and it doesn't really affect them. But it's important to screen your patients and think about this. Think outside of the box. You can deal with multiple chronic inflammatory symptoms if you have resistance to weight loss, if you have signs of excessive toxic load, if you get an IV and you feel like you're exhausted and you're dealing with something, or you feel like everything just came back, you probably have a lot of toxic load. And the question is, which ones, right? That's the question. So the most common symptoms of these are fatigue, weakness, chronic burning in the nose or the throat. You can have morning stiffness and joint pain, sometimes a loss of balance. So again, these are kind of weird, different symptoms, but you need to look into them and say, hey, these are not symptoms that traditionally fit into one category or one disease process. Maybe they're a result of our environment and our poor quality food and some of these different things. So the first of the two I want to talk about is Roundup, quote unquote Roundup, and glyphosate, I believe is how it's pronounced. It is the most commonly used herbicide in the world. this is non-selective, so it pretty much kills most plants. It basically stops the specific enzyme pathway. It's called the shikimic acid pathway, and it can actually exist in the environment for days to months. This has a tendency to exert a toxic effect on the neurotransmission and to induce oxidative stress, neuroinflammation, inflammation in the brain, and mitochondrial dysfunction, which is, at the end of the day, the root of all disease. Now, these processes lead to the death of nerves due to what we call autophagy, necrosis, or apoptosis, as well as issues to behavioral and motor disorders. Now, there is important discrepancies between the analyzed findings. It is equivocal that exposure to glyphosate produces important alterations in the structure and function of the nervous system of humans, rodents, fish, and invertebrates. So all across our food chain is literally getting damaged from this one product. And the problem we have here in America is that one company is funding another company, or you have this one that is indirectly being, persuaded by another company. So they're like, you can say this, but, still make it legal. So that's part of the problem. If you look on, the FDA's website or whatever government organization would write about this, I looked at it earlier. It's kind of like a mild, like, yeah, it may be harmful, but right now we don't think it's a big deal. If you look at the data, it's red flags everywhere. But big food and big farming is very, 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 very financially lucrative. So they're going to do what they can to preserve. And that's part of the problem. But they don't see how this is killing us and how this is affecting our children. This causes significant issues to the nerves. Can have genetic damage, can severely affect early stages. In my opinion, these are a major cause of developmental delay of children with ADHD and a lot of these issues with these neurological diseases in these youngers. You can even have prenatal and infant exposure that of glyphosate increases the risk of autism spectrum. In my opinion, that is likely the reason why a lot of our young children have all of these weird neurological diseases that we didn't really have 30, 40, 50, 60 years ago, because of all these chemicals and all of these toxins that we've introduced into the environment, the pesticides, the BPAs, that are supposed to maximize our earning power from that product. But when it goes into humans, it's awful. Your seed oils and all of this stuff. So the main issue is if a nerve does not talk to another nerve, you have a big problem. And that's what this chemical does. It damages that connection. It can damage the immune system. It can cause increased anxiety, depression, confirmed in mice. We've seen that some of these effects can actually happen at lower standards than they already set. So say it's at 1, we'll say, and maybe it starts at a half, but like, it only happens at over 1. Not everyone. How bad is your mitochondria functioning? Can you fight these? And so you're thinking like, how do I avoid this? Well, if you think about it, you almost have to eat gluten-free, because wheat and oats are the two most heavily pesticide products, or however you want to say it, crops. So if you're eating those regularly, you're going to get exposed to it. It's just inevitable, especially if it's American made. And you almost have to eat USDA organic, because that would be the gold standard, and say, no, this does not have any of those pesticides. It does not have any of those. And you're thinking, how do I get rid of it? It's a great question. This is tough. But humic And fulvic acid, which are soil-based probiotics, can help with this. Chelation, same things with heavy metals, can actually remove this and bind to this. The test that I use for this is a test by a company called Vibrant. That is an environmental toxin test. I was looking at one today, and it has about 15 or 20 different toxins. And you can see BPA's on there, which is in plastics. We'll talk about that in a second. It has glyphosate. It has all these different pesticides. So you can check that and say, hey, what are my levels? How high are they? This is destroying our gut. And the issue with our gut is that it's leading to leaky gut. It's leading to poor absorption rates. And a lot of our neurological hormones and serotonin, all of these are made in the gut. So if we're not able to make these, it's going to have a neurological effect in the brain, because there's that gut-brain connection. So all of these chemicals that we're consuming in our food that we don't really appreciate are having a substantial effect on your body, and that's why we're not nowhere near as healthy. We have all this inflammation and this chronic disease and diabetes and cardiovascular disease and all these cancers in younger patients. It's all of this garbage that's accumulating and all these toxins. So let's transition to the final one I want to talk about today, and that's what we call bisphenol A, or also known as BPA. Now, this is becoming much, much more of a hot topic. This is in plastics. This has been around since the 1950s, but they're really, really getting, quote unquote, very good at making these very small. And as a result, they are entering our cells, whether they're called microplastics or nanoplastics. And in particular, BPA is causing a lot of problems. Why? Because it's actually a weak synthetic version of estrogen. Yeah, but it's used as a chemical to help with the production of plastic. And it's used in eyewear, shatterproof windows, water bottles. So anytime you're drinking a water bottle, look on the side. If it says BPA free, you're good. If it doesn't say BPA free, you're eating and consuming that BPA every time it hits the sun, every time it's sitting in the trunk of your car or inside your car if it's hot. You don't know how many warehouses that was sitting in before it got to you. A lot of that water has all of this garbage in it, and we're slowly accumulating that stuff because the BPA is seeping into the water, into that product. So you're probably thinking, well, okay, I'll shift from plastic to metal. Okay. Unfortunately, they're also using BPA metal can liners. If you were to use acid to burn the metal around a soda can, you would see a plastic liner on the inside that you didn't know existed. That is leaching into that liquid that you're enjoying, and that's the BPA. So this is becoming a huge deal. These have massive negative effects on the endocrine system because it's binding to estrogen receptors, thereby influencing the body. This can interact with the thyroid receptors too, which are vital for functioning. Thyroid is needed for pretty much every major transaction in the body, usually T3. Thyroid is basically controls our weight gain, weight loss, brain function, energy, metabolism, immune system. Like, it's legit for everything. And this is another thing that can impact that. We've seen research that there was one study that showed 85% of Korean children under the age of 2 had detectable levels of BPA in their urine. Under the age of 2. Now think of that from an adult perspective. If you've been doing this for 20, 30, 40 years, what are these toxins causing? The body is a combination or a system of little mini systems. So what happens is, say A plus B, you start with A, you need to add B to make C. And then you have C, you're going to add D, and then you make E. And then it just continues. Well, what happens if BPA blocks B? You can't get to C until you get until you get either more B or you get rid of whatever blocking B. So you have this car accident kind of pile up because we don't. All these processes are slowed down because of all these heavy metals, all these toxins, our lack of nutrition in our diet, our lack of B vitamins. All of these are impacting these pathways. And this is why our mitochondria is breaking down. This is why we're having diseases earlier, because if your mitochondria, that powerhouse of the cell, is not functioning, you are not going to be able to heal and things start breaking down. Now, we're seeing BPA in a ton of products, canned foods. You can see it in toiletries for women, menstrual products, thermal printer receipts, eyeglass lenses, literally in front of your eyes all day long. Dental filling sealant, so literally chelating into your mouth, into your body, into your brain, because the brain is not far from your teeth. You can have it in pipes in the house or in a building, so where you may be consuming it or cooking with it. This is all of the issues that we may be experiencing. So you're saying, like, what are the potential health effects of BPA? Well, you can have infertility in men and women. It has been linked to PCOS and endometriosis in women. Okay, those are very complicated and very frustrating diseases. And you may be increasing your exposure simply because you're using something that has BPA in it. You can also see a link to obesity, heart disease, type 2 diabetes, which might as well be a sticker on an American. Those three go hand in hand, and unfortunately, this is starting to add to it. We have issues with children's behavior. This is likely also contributing to our epidemic of pediatric issues, poor attention spans, delayed, functioning, autism, a lot of Asperger's spectrums. I would not be surprised if this is a combination between many of these toxins, some of the heavy metals, some of the glyphosates, some of these BPA, some of these different toxins that maybe mom gave to baby in utero and you didn't even know. The poor kid was destined to fail and failure to thrive from the start because of different things in our environment. Now, we've confirmed microplastics and what we call nanoplastics, which is the smallest form, in organs, in blood, in brain tissue, in the placenta. And even more crazy, this came out maybe a month or two ago, they found nanoplastics in the plaques of our blood vessels of our heart. And there was a significant correlation to more disease if they had more nanoplastics in that plaque. So it's crazy, but you don't think about it until you start to see and you connect the dots. Okay, so what do I do? How do I treat this issue? First off, avoid BPA if possible. Buy BPA-free products. Look at a water bottle. It will say BPA-free on it. If it doesn't, assume it has BPA in it. Choose a different brand. Okay? Avoid heating anything with plastic in it. A microwave, a dishwasher. Any of these that have BPA, these are going to break down. You have food in it. Now that food that's going into your food. That's why about a year or two ago, I shifted all my plastic Tupperware to glass. You can get them. They're a little pricey. They're a little heavier, but they do not have any risk of this it seeping into the food. Buy some relatively reasonably priced, and as long as you don't break them, you really won't ever have to buy new ones, unless they're super dirty and you can't get them clean. But you really don't have the issues with the chelation of that ugly colors of the food onto the plastic because it's glass. You don't have to worry about that. Okay, focus on fresh foods, fresh whole foods that are not prepackaged. You will not have to worry about that. Pesticides, a separate discussion. Avoid plastic Use glass if you can, and stainless steel, ideally one that does not have a BPA liner. And then I have not finished it yet, but there's apparently a fascinating documentary called Plastic People that is apparently really interesting and about this topic. For this test, again, it's the test that we happen to use in my clinic is a urine-based test by a company called Vibrant. It's for their environmental toxins. There's a couple other types of toxins that we expose to every day that I just chose not to specifically talk about today, but I will mention them. Pesticides are super prevalent and unfortunately causing a lot of issues in our body, a lot of issues in our environment. It's very, very difficult to find fruits and vegetables that do not have any exposure to pesticides, which sounds crazy, but it's true. Try to find fruit that is pesticide-free confirmed. Very, very, very difficult. You're going to have to buy super premium USDA organic fruit, which is quite expensive, but justifiably worth it. Or you're going to have to get frozen foods, usually from Canada. I happen to get mine from Costco. But very, very difficult to find fruits that are pesticide-free. It's just very difficult because most farmers are trying to make more money and their crops will die sooner if they don't use pesticides. The other thing that I wanted to briefly mention is Lyme disease and its co-infections. Anaplasmosis and some of the other subdivisions of the co-infections that are super common, unbelievably common. I had a 24-year-old that had zero idea that he had Lyme disease. And again, it comes with these weird symptoms. The government does not like to talk about this. It goes back to about 20, almost 30 years ago when there was a couple committees, one of which said, hey, no, chronic Lyme disease doesn't exist. And the other one says, yes, it does. Unfortunately, the one that said, no, it doesn't exist, wrote the statement that the insurance companies adopted. And as a result, they do not, quote unquote, believe that chronic Lyme exists. We've seen physicians lose their license as recently as 6 months ago because they were giving antibiotics for more than several weeks to treat Lyme disease. This is a very sensitive topic, but there is a correlation we're starting to see in brain tissue that is exposed to Lyme disease that may actually be a sign of neurological disease. There may this may be a major culprit in neurological diseases like Alzheimer's because of the way that the body interacts with the Lyme. Lyme is very stubborn, very fascinating bug, very, very, very hard to kill. Unbelievably difficult to kill. That is another thing that if you're struggling, you have no idea what's going on, it's very difficult to confirm Lyme disease. I happen to use a very expensive test, but one of the only ones that I've been able to confirm that actually does a good job. It's made by a company called Vibrant, and they do a very good job. If it's positive on there, it's positive. You have it. Some of the other ones, it may be negative, but you still don't know if it's actually negative. So I hope you found that fascinating today. This is a part of my practice that is very interesting, that we optimize. A lot of my professional athletes get all these screened. And if you really want, if my full anti-aging protocol, I actually check for all of these. You have to be willing to spend the money because the testing is not cheap. But you can identify all these different things that are affecting your body, making you age faster, causing issues that you may not even be aware of until 20, 30 years down the road. All of these things that have tried to make our lives easier, unfortunately, end up making it causing more detriment to our health. If you like this type of content, do me a favor, smash the subscribe, maybe the thumbs up if you're watching on YouTube, or even consider, writing a review or sharing with some of your friends. I've talked about a bunch of different topics. This is number 13. So if you wouldn't mind checking out some of the other ones, we would love and appreciate your support. Thank you very much. We will see you next week.